Premature elimination of circulatory red blood cell is hemolysis, and this hemolysis causes hemolytic anemia. So in our today's lecture, we are going to study about the hemolytic anemia, and we will discuss it in detail about the different types of hemolytic anemia and their causes and their morphological features. So let's start our lecture with defining what is hemolytic anemia and what is basically the cause of it. So as I told you that hemolytic anemia is due to the hemolysis. Basically what happens due to any genetic defect or any reason, there is production of immature red blood cells that are quickly destroyed during their circulation. Now this hemolysis can be extravascular hemolysis or it can be the intravascular hemolysis. Mostly when the hemolysis is extravascular, it involves the spleen and to some extent it also involves the liver. But it is when it is intravascular, it totally involves the red blood cells, the circulating red blood cells. Now, there are different types of this hemolytic anemia, and that depend upon the site at which the red blood cells are being destroyed, whether in the while circulating or they are being destroyed in the extravascular side. So whenever there is the destruction or the quick destruction of immature red blood cell, obviously there will be a decrease in the red blood cell number that will stimulate the production of more red blood cell. So there may be the quick destruction of immature red blood cell, plus there will be the increased production of the red blood cells. So all the things, all of the different symptoms that are related to increased production of immature red blood cells, they may be seen while the patient will be suffering from the hemolytic anemia. So we can say that we characterize the hemolytic anemia by increased production of the red blood cells and increase or quick destruction of immature red blood cells. So let's get into the different types and different defects that lead to the hemolytic anemia. First of all, there is the erythrocyte membrane defects. Now, you know that the erythrocyte, that is the red blood cell, it has a membrane, outer membrane. This outer membrane is made up of a lipid layer, and then beneath the lipid layer there is a cytoskeleton. Means that there is the presence of protein, there is actin that is present there, there is anthyrine present there, spectrin is present there, protein 42 and also other such part of the cytoskeleton are present there. So whenever this structure is altered, whenever either there is the deficiency in anthyrine, either there is the some excess deposition of the lipid layer of this cell membrane, there will be the erythrocyte membrane defect. And whenever there will be the defect in the membrane of red blood cell, what will happen? The red blood cells will be irregularly shaped. The shape change that you mostly observe in the anemia is basically due to this defect in the erythrocyte membrane. Now, this is the normal shape of a red blood cell, that is, it is a disc-shaped cell, right? Whenever there is any defect, there can be the acanthocyte production or acanthocytosis. Acanthocytosis is the condition where there is the production of acanthocyte. Now, acanthocyte word is basically derived from the word acantha. Acantha means thorn. So we can say that there is the presence of irregular spikes in case of acanthocytosis, or this red blood cells that will be formed in the acanthocytosis, or that are known as acanthocyte. They will have irregular shape, like they will have like thorns on their surface, and they will be irregular acantha formation. Then there comes the acanthocyte. This happen in case of acanthocytosis, and in such cases, mostly there is the extra deposition of the lipid in the membrane layer, and this extra deposition lead to the formation of there is the formation of irregular thorn-like shape in the membrane. But as compared to acanthocytes, the acanthocytes are regular in shape as compared to the acanthocytes that are irregular. Then comes the spherocytes. Now, whenever there is spherocytosis, there is the formation of these spherocytes. Spherocytes are basically spherical in nature. Mostly, the normal red blood cells, they are biconcave and they have disc-like shape. But in case of the spherocytosis, the shape is more spherical. Then poikilocytosis are the fragments. Poikilocytosis, I have told you in the previous lecture that poikilocytosis means that irregularly shaped red blood cells that appear during the anemia. Then there is the elliptocytes. Elliptocytes occur during the elliptocytosis. In the elliptocytosis, there is a formation of elliptical red blood cells that are more, you can say, that are more flat as compared to the normal cells that are more disc-like shape and biconcave cells. Then there is the stomatocytes. Stomatocytes that occur during this stomatocytosis, they are basically the red blood cells that have polar in their center. And I have told you about the polar when we were studying the other different types of anemia. That polar is basically an area at the center of the red blood cell here that is hypochromic, means the pigmentation is less in this area as compared to the rest of the rest of the parts of red blood cells. So this is known as stomatocytosis or stomatocytes. So these all are the membrane defects that may be present. Now we will discuss about all of these membrane defects one by one. First of all, the hereditary spherocytosis. Now, I have told you that this spherocytosis is basically when the cells become more spherical and they are no more biconcave, disc-like shaped red blood cells. So what basically happens in case of this spherocytosis? In spherocytosis, there is the deficiency in the proteins that are part of the erythrocyte cell membrane cytoskeleton. There is the deficiency of spectrin. Mostly there is the deficiency of spectrin along with any other protein that is present in the cytoskeleton. There may be the deficiency of spectrin and chirin, or there may be the deficiency in band 3 or protein 4.2. These are all are basically part of the cytoskeleton of red blood cell membrane. Now, whenever there is the deficiency of these protein, this will lead to the production of spherocytes that are abnormally shaped red blood cells. And also there will be the release of microvesicles in case of both deficiency. Now, these spherocytes basically they are abnormally shaped cells, so they will undergo splenic trapping and erythrocytosis. They cannot flow in the normal circulation, and they will be destroyed earlier in their lifespan. Like what will be the result of this splenic trapping and erythrocytosis? There will be the decreased pH. There will be the increased macrophage contact. When a macrophage contact will increase, it will increase the hemolysis of the cell. So this spherocytosis will undergo the hemolysis and causing the hemolytic anemia. Further, there will be the loss of membrane and there will be the formation of microspherocytes. First, there will be the formation of spherocyte, and then there is a further loss of the membrane, that is the microspherocytes will be formed, and again they will undergo splenic trapping, and again they will come in contact with the macrophages and there will be the hemolysis. So this is all that happened during the hereditary spherocytosis, and basically the thing that you have to remember is that there is a deficiency of spectrin and any other protein like protein maybe 4.2 or and chirin that lead to the production of spherocytes that are immature cell, that are abnormal shaped cell. That's why they undergo hemolysis, causing the hemolytic anemia. Now, let's discuss the pathology of these hereditary spherocytosis, that how these cells appear in a histological slide, or what is their morphology. Basically, these cells they cause normocytic anemia, and they are hyperchromic in nature. And if you look at these cells, they are hypochromic. They are rich in pigments, and no pallor is present there. And also, there, in case of this hereditary spherocytosis, there is the reticulocytosis that occur, and poikilocytosis. Obviously, these are an abnormally shaped cell. So this is how you distinguish these cells, and also these cells are more spherical as compared to the normal red blood cells. Now, coming to the clinical feature that a patient suffering from the hereditary spherocytosis will manifest. There will be the splenomegaly. Now, the red blood cells that are being destroyed, obviously, what is the site where they will get after their destruction? Or we know that spleen is known as the graveyard of red blood cells, and also it is a place or a site for extravascular hemolysis. That's why there will be the overburdening, and there may be the hypertrophy of these cells that are present in the spleen that will ultimately lead to the splenomegaly. Then the patient may be jaundiced. He will be suffering from the jaundice, and the different symptoms of the jaundice, like the yellow color of the skin, and like abdominal pain. All of these symptoms will be presented or manifested by the patient suffering from spherocytosis. There may be the cholelithiasis, the gallstone may be due to this condition. And also there can be the aplastic crisis. Now, aplastic crisis are basically the condition when there is the no production of red blood cell by the bone marrow or the different stem cells. There is no production of red blood cells. And then there can be the hemolytic crisis, where there is a quick destruction of red blood cell in the during the circulation. So these are all the clinical features that can be manifested by the patient who is suffering from the hereditary spherocytosis. Now let's talk about the hereditary elliptocytosis. As I have told you, in the elliptocytosis, there is the formation of elliptocyte, that are red blood cells that are more elliptical in shape as compared to the regular biconcave disc-shaped cell. So let's see that what happened in case of hereditary elliptocytosis. This is basically a diagram, a model that is showing the cytoskeleton of a normal red blood cell. In case here you can see that this is basically the alpha spectrin. This is the beta spectrin. This is there are two types of the spectrin proteins present here, alpha and the beta. Then glycoprotein C is also part of the cytoskeleton, protein 4.1 and actin. They are now you can see in this diagram that they are arranged in a specific order. There is actin and then protein 4.1 arranged in a circular fashion, and then the spectrin is responsible for cross-linking, and here the glycoprotein is attached at this point of the alpha spectrin. Now, there is a specific arrangement of all of these protein in the cytoskeleton. What happened in the elliptocytosis? In case of the elliptocytosis, there is the alteration in this arrangement of the protein, mostly in the arrangement of the spectrin, alpha spectrin, or protein 4.1 and the glycoprotein C. The arrangement of these three proteins is altered in case of elliptocytosis, that lead to the formation of elliptical red blood cell and cause the hemolytic anemia. tropomyosin is also part of this cytoskeleton of the red blood cell. This hereditary erythrocytosis is mostly the autosomal dominant, and it causes the mild normocytic anemia. Now, this is a histological diagram that is showing the morphology of the hereditary erythrocyte. Now, if you look at this slide, you can see that the red blood cells are more elliptical in shape as compared to the normal red blood cell, and also they have a very mild pallor in the center, and usually because the lipid layer is not affected at all, that's why it usually have a very mild pallor, and it cause mild anemia. Maybe the patient may be asymptomatic as well, and there is a mild hemolysis, mild anemia, and all the clinical features that appear, they are mild in nature, and also the anemia is normocytic. Moving on to acanthocytosis. Acanthocytosis is, the thorns, this spiny nature of the or spiny shape of the red blood cell. So here, in case of the acanthocytosis, there is the irregular shaped cell where there is the formation of these spines or these thorns that are irregular in nature. Now, this is basically this acanthocytosis, or maybe the echinocytosis, where this spiny formation will be more regular as compared to the acanthocytosis. Here, what happened that there is a defect in the lipid membrane of the red blood cells. Now, this defect is mostly due to the liver disease. In case of any liver disease where there is the increase in accumulation of red blood cell, the lipids, there is the increase in the accumulation of lipid and cholesterol. Mostly there is the beta lipoproteinemia that results in increased deposition of the lipid in the red blood cell membrane, that will alter the shape of the red blood cells, and that will lead to the acanthocytosis, or that will lead to the echinocytosis. And also because here the lipid membrane is being affected, then here you can see that there is a significant pallor that can be seen in the red blood cells suffering from acanthocytosis. And these are this spiny shaped irregular thorns that are projected from the red cell membrane. And the cells are hyperchromic in nature mostly, and there can be a severe disease as well, or there can be the mild conditions also associated with the patient who are suffering from the acanthocytosis. However, the reticulocytosis is mostly mild in the nature. Now, coming to another cause of the hemolytic anemia, that is the enzyme defect. Till now, we have studied about the inherited defects in the red blood cell membrane that was due to some genetic defect, and that altered the shape of the red blood cells. Now, here we are going to talk about the enzyme that will cause the red blood any defect in the red blood cells and cause the hemolysis. Now, basically, the most important enzyme here is the glucose 6-phosphate. That will be converted into the 6-phosphogluconate plus NADPH and plus hydrogen ion will be liberated in our body. That is the process of glycolysis, Now, what is the role of this enzyme? It is important because the red blood cell capture the energy, or you can say that the source of energy for these red blood cells is this glucose 6-phosphate. So whenever there is a deficiency of this enzyme, that will obviously affect the amount of the energy that is being produced, and that will affect these red blood cell synthesis as well. Whenever there will be the decrease in the glucose 6-phosphate dehydrogenase, this will lead to inadequate supply of NADPH. Obviously, the glucose 6-phosphate will not be converted into the 6-phosphogluconate, and NADPH will not be produced. There will be the reduced level of the glutathione, and the glutathione role is to protect the hemoglobin. oxidation. Whenever glutathione is not present, hemoglobin will get oxidized, and it will no more be available for the synthesis of red blood cells. There will be the production of immature red blood cells that will undergo hemolysis, and patient will suffer from anemia. Now, during this whole process, there is another important enzyme that is known as the pyruvate kinase. This pyruvate kinase is also very important in causing the defects in the red blood cells. So that's all about the enzyme defect that will happen. Also, if we talk about the morphological features of these cells that will be deficient in the hemoglobin, they will have polar, they will be hypochromic in nature, and these all features can be seen in the red blood cells that are in the patient that are suffering from the enzymatic defects. Now, there is another type of hemolytic anemia that is caused by the immune disorder or immune defects. These type of the hemolytic anemias are known as immune or autoimmune mediated hemolytic anemias. Basically, as the name is indicating here, either there will be any immune disorder or there will be the autoimmunity involved in the production of antibodies against the erythrocytes that will obviously cause the hemolysis and ultimately lead to the hemolytic anemia. Now, there will be the hemolytic anemia that will be caused by this kind of the defect can be severe in nature and can be very, very severe as well. Now, at this diagram, you can see that these are the RBCs with IgG or complement C3 protein that is bound to these red blood cells. And these are the incubation with antibodies to human Ig and complement proteins. And then there is the agglutination positive direct Coombs test. Now, before going into detail, this is about the Coombs test. Before going into details of the Coombs test, let me tell you a little more about these autoimmune and hemolytic anemia. Basically, what happens that there is the presence of antigen on the red blood cells. Like here, you can see that the antibody binds to the red blood cell. Now, why antibody will bind to the red blood cells? There will be the presence of antibody on the surface of red blood cells, to which the against which the body will produce the antibodies that will come and bind to these specific antigen, and obviously the normal system of our immunity will be activated, and there will be the macrophages, reticulocyte that will engulf the red blood cell or cause the hemolysis, leading to the hemolytic anemia. But there can be another condition, that is the autoimmune reaction that will lead to the production of the antibodies against the red blood cells and will cause the destruction. Now, there can be the production of autoantibodies and alloantibodies as well. Alloantibodies means that the antibodies that are produced by when the patient is exposed to the antigen that is present in the, like here in case, that is present on the surface of the erythrocyte. So whenever there is such case, the hemolytic anemia will be known as the immune or autoimmune hemolytic anemia. Now, this Coombs test is basically performed in case of the hemolysin disease that we will discuss in our coming slides. In that disease, what happened that there is the agglutination that occur, and that lead to the autoimmune anemia. Basically, in case when there is no antigen present on the surface of the red blood cell, rather there is the production of autoimmune antibodies. Whenever they are incubated, these antibodies will undergo agglutination and will lead to the formation of these agglutinated red blood cells that will help us to identify, to diagnose the patient who are suffering from such kind of the hemolytic anemia, from the different other types of the hemolytic anemia, like the defects, the hereditary defects and the enzyme defects as well. So let's get into the different types of autoimmune and immune-mediated hemolytic anemia. There are three types of these type anemia. The first one is the warm antibody autoimmune hemolytic anemia. Now, in this case, what happened that the production of antibodies take place in the patient at the temperature of 37 degrees centigrade. What happened basically is that there is the presence of antigen on the surface of the red blood cells. That is mostly in most of the cases there is the that is the protein, and that is not attached to the surface of the red blood cell, rather it forms a coat around the surface of the red blood cells then that will stimulate or generate the antibodies, and these antibodies will then come towards the red blood cells. There will be the accumulation of the macrophages, there will be the accumulation of other cells that will then cause or simply engulf the red blood cells. Now, if we talk about the different other causes of this type of the hemolytic anemia, there can be any drug that is causing the production of these antibodies. How? Like just take the example of the penicillin. What happened that penicillin, in some cases, penicillin get attached to the surface of the red blood cells. When the penicillin will get attached to the surface of the red blood cell, what will happen that the antibody will be produced. Here, I forgot to tell you that in case of this type of the anemia, there is the production of IgG antibodies. IgG antibodies will be produced, and the subsequent reaction will take place, and there will be the hemolysis of the hemolysis leading to the hemolytic anemia. So that's all that occur in case of the warm antibody autoimmune hemolytic anemia. Now coming to the pathology of this kind of the anemia, if you look at this diagram, they both are showing the cells of the person who is suffering from warm or antibody autoimmune hemolytic anemia. Now, if you look at these cells, they are more spherical in nature as compared to the normal biconcave disc-shaped cells, and there is a pallor that is present in the center of these red blood cells, and they are hypochromic in nature. Now, this is, I think this is the only type of the hemolytic anemia that I'm going to tell you that it is macrocytic in nature. And also here you can see that there is the agglutinates of the cells that are formed, and these agglutinates are basically formed because of the agglutination reaction that I just talked about in the previous slide when we were talking about the Coombs test. So this is basically the morphology that can be seen in the patient who is suffering from the warm antibody autoimmune hemolytic anemia. And talking more about the patient who will suffer from this disease, there will be the hemoglobinuria, and also the serum hemoglobin level will be decreased in such kind of the patients. Now coming to the cold antibody autoimmune hemolytic anemia. Here, the temperature at which the antibodies are produced, it is 4 degrees centigrade, and mostly at the peripheries the temperature is decreased, and when the temperature is decreased, what happens that there is the production of antibodies, and there is the agglutination that is basically due to the decreased temperature as well, and also because of the autoimmune reactions. Now, when the temperature is decreased and at the periphery, what happens that the IgG and IgM antibodies are produced. IgM are basically the major antibodies that are being produced in such kind of the patient, and they will be they will bind to these red blood cells and will cause the agglutination of the red blood cells. Now here, if you look at these red blood cells who are taken from the patient who is suffering from cold autoimmune hemolytic anemia, There basically there is a significant pallor is also present here. They are hyperchromic in nature, and when agglutinated, then you cannot identify the pallor that is present here in these cells. And also there is the poikilocytosis. They are more spherical in the shape, and in such kind of the patient will also suffer from the severe hemolytic anemia or the anemic state. So, talking about more of such kind of the patient, they will also suffer from the hemoglobinuria, and the hemoglobin level will also be decreased in such kind of the patients. Moving on toward another type of the autoimmune or the immune-mediated hemolytic anemia is the cold hemolysin disease. Now, in this kind of the hemolytic disease, there is also the production of antibodies at the lower temperature, just like it was in the cold autoimmune hemolytic anemia, and also there is the agglutination reaction that takes place here, but obviously the cause that is different from the previous type of the anemia. Here the hemolysin, the P antigen. P antigen is present on the surface of the red blood cell. That is basically cause of production of allo antibodies, and that lead to then the hemolysin disease and further cause the activation of the C protein that will then cause the hemolysis and leading to the hemolytic anemia. A proper cascade of the reaction that is that you have studied in immunology about the C3 protein and C-reactive protein, it is activated, leading to the hemolysis of the red blood cells and causing the hemolytic disease. Now coming to the hemolytic transfusion reactions. Hemolytic transfusion reactions are basically the patient who is transfused with the red blood occur may also lead to the hemolysis. Now, how it may lead to the hemolysis, let's see. Mostly the patient who is transfused, who has some kind of the autoimmune reaction, he is transfused with the incompatible red blood cells. Maybe mostly this is because of any kind of the mistake. Then what will happen that the patient will undergo severe hemolysis. The patient will undergo the renal dysfunction. There will be severe hypotension, and also the liver of the patient will be affected, and in most of the cases it is difficult, the survival of the patient is difficult. And if you talk about the Coombs test, in this case the Coombs test is positive, because here there is when the patient who was already suffering from the autoimmune hemolytic disease, he is then transfused a wrong type of the blood that is mismatched. This will cause the agglutination that will or the clumping of the red blood cells due to the presence of the antibodies, and again there is again the production of antibodies against the mismatched red blood cells. So there will be the massive agglutination that will lead to the hemolysis, and severe type of the hemolytic anemia will result, along with other severe conditions that I just have told you. Then, when the patient, as compared to this, the other state is that the patient is now the patient is infused with a blood of from the compatible donor, and in such cases, what you will see that the Coombs test it will be or the direct agglutination test will be negative. Now, there can be the two conditions in hemolytic transfusion reactions as well. The one where the patient was already suffering from the immune disease, and he is transfused with the mismatched blood, and there is the massive hemolysis, and the patient will suffer from the severe hemolytic anemia. But there can be another condition where the patient is not suffering from autoimmune hemolytic anemia, but he is transfused with the mismatched blood that what will happen that in this case also there will be the production of antibodies, but maybe after a while, when the patient is diagnosed that the blood is mismatched, then the transfusion is stopped, then gradually the symptom will decrease, and the antibody production will decrease, and the different other system of the body will be activated, and the body will cope up with this kind of the reactions, and the condition will get better. So it is less severe as compared to the hemolytic transfusion reactions in the patient who is suffering from autoimmune hemolytic anemia. Another type of the autoimmune disease is the hemolytic disease of the newborn. Now, as the name is indicating, obviously it is related to the fetus and the mother or a new born baby. So what happened in this kind of the anemia? Basically, in this kind of the hemolytic disease, the mother and the fetus, their blood type is mostly the blood type is the different, and the main cause is basically the absence of an antigen in the mother that is present in the fetus on the fetus RBCs. Now, because of this reason, the blood or the immune system of the mother will produce the alloantibodies, and these alloantibodies will cross the placenta, enter the fetus, and when they enter the fetus, there they will cause the destruction of the red blood cells, because the antigen that was absent in the mother, it is present in the fetus, and to which the alloantibodies will bind and will cause the destruction of the red blood cell. So the baby will suffer from the hemolytic anemia, from the hemolysis, and such cases lead to the formation of the erythroblast. Like here in this diagram, you can see that there is the formation of erythroblast that also have a little pallor in their center, and that are hypochromic in nature. Basically, in most of the cases, when there is, if we talk about the ABO blood group system, the mother is of the O type, its blood type is O, and the baby have the A type of the blood. And if we talk about the Rh system, then mostly the mother is Rh positive and the baby is negative. And moreover, the antibodies that are produced in this type is IgA antibodies that are produced in Rh type of the case. So in this condition, the hypochromic and the cells that will be produced, red blood cells, they will be enlarged. Their size will be more as compared to the normal cells. There will be the formation of erythroblast that will cause that will lead to the hemolysis and will cause the hemolytic anemia. Now let's talk about the non-immune mediated hemolytic anemia. And non-immune mediated hemolytic anemia may be due to any other reason that lead to the destruction of red blood cells or cause hemolysis. Now what can be that reason? That can be obviously any fragmentation syndrome or any mechanical distress. Now what kind of the mechanical distress that we are going to talk about here? Basically, what happens that the red blood cells are intrinsically normal, but what happened that there is any mechanical stress during their circulation in the blood vessels. Maybe there is any thrombosis, or maybe the surface of the vessel is rough. Every time these red blood cells striking with the thrombus, every time they are striking with the surface of the endothelial vessels, they are causing the destruction of red blood cells. They are destroying the membranes of the red blood cells. That basically lead to the fragmentation, and that lead to the hemolysis of the cells. There are various diseases that are included in such kind of the conditions. Mostly the thromboembolic diseases are part of such kind of the syndromes. Here, if you look at the morphology of this type of the red blood cells, you can see that they are highly irregular in their shapes. folliculocytosis is very severe, and some of the cells are hypochromic in nature, and also they have polar in their center, more spherical, sometimes spherical in the shape, but the shape can be irregular depending upon the type of the amount of the mechanical stress the red blood cells are suffering or facing. Maybe the size of the thrombus, or maybe the level of the irregular texture of the endothelial cells. Moreover, in this type of the patient, the mechanical stress increases or decreases because of the trauma. Trauma can be a factor that increases the hemolysis or the mechanical stress, or if the patient is doing any exercise or intensive exercise or any such kind of the activity, then also the mechanical stress increases, that may lead to the fragmentation or hemolysis of the red blood cells. So this is one type of the non-immune mediated anemia, hemolytic anemia. Then hypersplenism can be another reason of the hemolytic anemia. How? Because spleen is the place that you can say that it is the exit place for the red blood cells. Whenever there is the hypersplenism, obviously the function of the spleen is reduced. So what will happen, that there will be the pooling of the blood, and the transit side of the erythrocyte is basically, you can say that it is blocked. So that's why it may lead to the stress, and it may lead to the hemolysis, pooling of the blood, and that's why the patient may suffer from the hemolytic anemia. But in such cases, the hemolytic anemia is mostly mild as compared to other type of the anemias, and the patient will manifest mostly normocytic anemia and a bit irregular shaped red blood cell as compared to the another type that we just have discussed, the mechanical stress or the fragmentation syndrome. There are also some other types of the anemia. If we talk about the non-immune mediated anemias, like the anemias that are due to any other disease, that may be due to any other defect, or that may be due to some drugs as well that lead to the damage of the red blood cells and may cause the hemolysis. So this was all about our today's lecture, in which we covered the hemolytic anemia. We started with the hemolytic anemia definition, that it is basically due to the hemolysis, quick destruction of the immature red blood cells. So polychromasia is the diagnostic parameter of this hemolytic anemia. Polychromasia means the quick destruction of immature red blood cell, and quick production as well. So basically, we talked about the different types of hemolytic anemia. First, we discussed about the inherited defects that lead to in the membrane of the erythrocyte, that lead to the irregular shape of the red blood cells and their quick destruction and causing the hemolytic anemia. We talked about in detail about the hereditary spherocytosis. We talked about the acanthocytosis and also other different membrane defect as well. Then we talked about the enzyme defects, that how the enzyme deficiency lead to the decrease in the energy level for the red blood cells, that is basically the source of for their proper flow, their proper synthesis and functioning. Then we talked about the immune mediated hemolytic anemia. We talked about that how antibodies are being produced against the red blood cells because of the specific antigens that are present in the red blood surface, maybe a protein, maybe any drug like penicillin as well. Then we talked about that there are various types of the autoimmune mediated hemolytic anemia. We talked about the cold body autoimmune hemolytic anemia, the warm body autoimmune hemolytic anemia, hemolysis. We talked about the cold hemolysis disease, and also we talked about the hemolytic disease in the newborn, that is basically due to the absence of an antigen that is in the mother, that is present in the fetus, that lead to severe type of the hemolytic anemia. Then at the end we also talked about some non-immune mediated hemolytic anemia and some other type of the hemolytic anemia that may be due to the stress, that may be to the hypersplenism. Now, summarizing all our lecture is the thing that only the destruction of the red blood cell, the quick destruction, is the reason of the hemolytic anemia, and that is obviously then predisposed by various other diseases as well. So this was all about our today's lecture. Thanks for watching sqadia.com.